And we take it and hello, good morning. Happy fall today. Welcome to this partnership at Drug Free New Hampshire Facebook Live. My name is Julie Yerkes, and I'm the community engagement lead for the partnership. And I want to say thank you for joining us for this Facebook Live where we explore current prevention initiatives around the state of New Hampshire and really get to dig deep and kind of understand them a little bit because they can sometimes seem a little far off. And so today, the partnership is recognizing National Substance Use Prevention Month. This is a initiative through SAMHSA, the Substance. What is SAMHSA? Substance Abuse and Mental Health Services Administration, which works to provide information and resources to prevent substance use and mental health disorders. So today we are here with Jennifer O'Higgins from the Department of Health and Human Services, Senior Policy Analyst, and we're really excited to have Jenny here to talk with us about her role and how prevention is working out in the state of New Hampshire. And I have a couple of specific questions, but Jenny, could you just introduce yourself first so everyone knows who we're talking to?
Yeah, sure. So, hi, Julie. Thanks for having me on. So, I'm Jenny O'Higgins. I'm a senior policy analyst with the Division for Behavioral Health at DHHS. And my role is really focused a lot on legislation and how we change our laws to better support folks and have access to care, inclusive of prevention and treatment and recovery. And I look across mental health and substance use disorder and look at how we can integrate those topics even closer and our services even closer. And I come to this work from the lens of being a youth services director for a number of years. So my own expertise is in prevention, and my passion lies in prevention and working with young people. And I also oversee the state's implementation of 988, the Suicide and Crisis Lifeline, and our suicide prevention coordinator. And so that work is all very closely related. And we have a lot of exciting things going on, both for, Substance Use Prevention Month, but also all throughout the year.
Yeah, great. Thank you. Thank you so much for being here. Jenny and I have worked together in the past in other capacities, and so it's nice to see you here today. So recently there was a press release about the most recent 2023 Youth Risk Behavior Survey data. And that's sort of what prompted me to think of you to come on today. And I just wanted to ask you to tell us a little bit about the Youth Risk Behavior Survey and how that fits into prevention.
Yes. So the Youth Risk Behavior Survey is really it's the way that we collect data over time around a number of health related issues, including behavioral health, right? So the Youth Risk Behavior Survey it talks about unintentional injuries and violence. It talks about sexual health behaviors. It talks about alcohol and other drug use, inclusive of tobacco use, and dietary behaviors and physical activity. And so we get a lot of this information directly from young people, and we get to see trends over time that show, where we might need to really invest in prevention. So having that data is very critical piece of how to do strategic prevention.
Great. Thank you. And what about the 2023 YRBS? What are we learning from that?
Yeah, so I think we've seen, some slight leveling off, some slight dips in some mental health challenges that young people have faced. We've continued to see some decline in some areas of alcohol use. And so those are, good things, but some of that is that we're not out of the woods yet, that we need to really keep our foot on the gas in prevention and make sure that we continue to to look at these numbers and to monitor them. Some of those mental health numbers really increased during COVID for kids. So there was, probably increased isolation and social isolation and feelings of loneliness. And so what we don't know yet if we're seeing just like a leveling off since pre-pandemic numbers, or if those will continue to decline. So while we're really happy to report some of those numbers going in the right direction, we need to continue to monitor the trend over time. And in some of these areas, our numbers are still significantly higher if we look at the trend data over the previous years, right? So they may be leveling off back to 2021 numbers, but they weren't going in the right direction prior to that anyway. So I think it allows us to have an understanding of where our kids are at today. And and we're seeing some things in there that we are happy to see, that we're happy, slight positive changes. But those are in areas that are always concerning, things like persistent sad and hopeless, right? Or have ever thought of suicide. And so that we need to really be watching those very closely and make sure that we're able to give people the services that they need.
So speaking of, so how does the youth risk behavior survey data then translate into what you're saying about getting the services that kids need? Like, how do we use that data, both maybe at the state level, or I know you've worked in communities, how is that data translated into supporting and improving outcomes for youth?
Yeah, so that's really the crux of the issue. That's the most important, question, I think, because what happens is that you can look at this data and schools or communities or nonprofits or youth coalitions, right? Anyone doing prevention work and youth themselves can look at that data and can understand where we need to dig in for prevention and intervention and where we're actually like doing okay. Right. And so when we look at some of those percentages, things that, have changed in the 2023 data, we're seeing, okay, approximately 40% of students reported that they felt sad or hopeless. And while there is that slight decrease, it was 44% in 2021, it's still elevated. But it also marks the first time in a decade that the percentage of students has decreased at all compared to the prior 2 years. And so it's really good for us to see that, and it's hopeful, but then it helps us to take that kind of data and translate the data into action. So we'll say, well, then, because, what did we do differently between these periods of time that may have helped that to trend in the right direction, or what could we be doing to make sure that these things that we see these changes over time that we're looking for. So you can get the YRBS data both on a state level, but also a regional level, and school districts can request it as well. And so those schools can look in and say, what does it look like for our students to feel like they're connected with, their school connectedness questions. So that can be really helpful indicators for schools. We can have prevention, coalitions looking at, okay, is binge drinking the concern, or is there a concern around stimulants, or is there a concern around, opioids? And they drill down to have like more specific information. And really, it's the most kind of critical data set because it comes from kids. And so we can't, make assumptions that we know what's going on with youth. We've got to stop and ask them. And the YRBS is the way we do that.
Yeah. Yep. And, there's a lot of information around the YRBS available through both the DHHS website. You can go there and you can see the report, right? And both at the state level and broken down, as well as there's, and I'm asking Julianne if she could find that or put that website in the chat, but also I know that there's some more information around the YRBS as well about its importance and some frequently asked questions that can be shared through the New Hampshire TAC, Technical Assistance Center. There's some great information there as well. So good way to learn a little bit more about it. There are often questions around it. I know families, these are sensitive topics, right, to be asking young people, and that can be a concern. And I do know that there's a lot of research done. It's a the Centers for Disease, right? It's a national survey. A lot of time is spent vetting the questions and ensuring that they're appropriate to be asking young people. So that's just wanted to share those resources if anyone wanted to learn a little bit more about it. Can you mentioned youth can use the data.
Yeah, of course.
You,
So first, the survey is anonymous and voluntary. So the topics feel sensitive because we're worried about our kids and we want them to be safe. And so ultimately, just to make sure that everyone kind of has this context, talking about topics that are difficult doesn't plant an idea in anyone's head. It actually is met with a sense of relief if that's something you are experiencing. And so making sure that you feel heard and validated and that people are going to do something about it is actually prevention in and of itself. And so in some ways, just administering the survey is good prevention, right? Because we're telling kids, we're here, we're listening to you, and we want to do something with this information, and we want to make sure your voice is heard. But the survey is completely anonymous. There is no way for us to identify like who the person is. And it is very well vetted in the way that to know that the data is valid. So young people use.
Thank you for putting that context on that. I think that's really helpful.
Yeah, and so the young people can use the survey themselves in that we have many youth groups that are involved in their like coalitions in policy work, young people who show up and testify at the State House who are looking to make policy around substance use, suicide prevention, mental health, because this is their state and their country, and they're able to weigh in and use their voice in whatever way makes sense. And this impacts them directly. And so when young people are able to look at the data and say, yep, I think this is kind of what I'm seeing. My peers are, involved in this or that. But they can also then add more context to it for us as adults or prevention folks to say like, well, here's what I'm hearing or my peers are saying. We've seen coalitions use the YRBS to normalize like non-risky behaviors, to say things like a huge percentage, the majority of our students in our school are not binge drinking. So while it sounds like there's some narrative that, not suggesting this is happening in every school, but for example, if there's a narrative that everyone is going out on the weekends and using alcohol and binge drinking and this kind of thing, you can do social norms prevention by saying, actually, 80% of students in this school are not binge drinking. They self-reported that. Or, X number of folks are not using tobacco. And so some of that can help. Who doesn't want to both stand out and feel normal as a teenager, right? So it's like, I want to feel normal while trying to be unique. And, so really understanding where our peers are at can be really helpful for adolescents. And then for us as folks doing prevention, we're able to take that data and help it to inform practices and policy. And without it, we're guessing.
Yeah. Right. It's like throwing darts, right? Or me throwing darts because I'm all over the board. So it's nice to have, a really specific, to know what we're trying to do. I did want to just mention that there is, getting youth to understand and look at the data and getting their feedback and all that. There's a program or a process called Getting to Why. And that is there are some communities in New Hampshire that are doing that. And we did a Facebook Live with Liz Brochu last year on this because they were doing it up in central New Hampshire. And what that does is with training, working with young people to understand data, look at data, understand what it means, and then they work to then share it and do listening sessions and get feedback from more students, and then work to take that and say, well, what should we do about this, and kind of bring it into a community action or a policy response. So it's great to see that young people have access to their own, right? That's a best practice right there. That if there's work being done about you, that you should be involved in it.
Absolutely.
So young people being involved in understanding, using, and taking action on their own data. Um, I I want to bring our attention to our live audience who are asking some questions in the chat. We have a question from Lisa Vasquez, and I'm not Castro, who is asking if there are any specific groups that have higher numbers of risk in New Hampshire that we should be focusing efforts on. And that's really data specific, so we may not have the answer here. I don't know, Jenny, if you do or not.
Yeah, I mean, certainly, I think that's something for each community to dig in and look at. Like, I know that in terms of our suicide prevention efforts, that our LGBTQ population of young people are very significant number, almost 3 times more likely to have thoughts of suicide. So that's something that kind of stands out for me when I look at this data. But I think within different communities too, you have different populations that are less likely to have access to the same resources. And while nationally we're seeing a slight trend downward in suicide numbers, we're not seeing that for Black youth in particular. And so just thinking about like looking at our data in ways that are not just looking at all of our data, but then breaking it out to make sure that we're looking at, is this different for different populations? And it often is also different by gender. So we often have like females have young women are reporting a higher rates of sadness and hopelessness and things like that. And so while I can't remember all of the areas that we saw in the report off the top of my head, I do know that if you're doing this work in your community, it's so worth digging into that data. And you can put in data requests through the superintendent of the school district too, to DHHS, to help to look through some of that. And that can be really wonderful for districts to have a deeper understanding of what's going on with different populations within their school, because there certainly is a difference in risk, and we know that to be true, and it better informs our prevention. So thanks, Lisa, for asking that.
And if you're not really sure where to get started on that community level too, I want to point out that also on the DHHS website there are the regional public health networks and the contacts for the substance misuse prevention coordinators who do a lot of work on the community level to look at the data in the region and start initiatives to positively impact those outcomes for young people and across the age, across the lifespan. So if you are hearing this and you're like, I want to get involved in prevention efforts, that's a great way to start. You can also go on to the Partnership at Drug Free New Hampshire's website and go to For Families or For Communities. And there are tips and strategies and contacts on those 2 pages to reach out to us or your local prevention coalitions or regional public health network folks in order to get involved in your community, because it really does take a community effort, and then also learn more, right? Like what else, how do we keep learning about how to support young people and our peers in having the best mental health and avoiding harmful risks that we can.
I'd add to that a little bit, Julie, too, is that like with everything to do with behavioral health, substance use and mental health inclusive. When I say behavioral health, I mean both. It's on all of us. These are community issues. And if we can have the courage and language to talk about these things, then we're able to then sit with folks when they are maybe in crisis or experiencing concerns. And so I would also say, like, think about getting trained in, mental health first aid or QPR or Connect or many of the various programs that are out there and that the regional public health networks offer. And then just as community members, think about how you can be a part of the solution. And then one of the biggest things I'd say is that we have to listen, 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 listen to kids.
Mm,
And we don't live in the same world that we grew up in. And that's
yeah.
always true generationally, but I think it's changing really rapidly now too. And so if we're not listening to kids, we're making a lot of assumptions and we're probably wrong. And so the YRBS is one of the ways that we listen to kids, but there are so many other opportunities too. Listen to your own children, listen to their friends, listen to the school, like kids that you work with. All of that, and make sure that they help inform how prevention happens, or we're likely to miss the mark.
Yes, absolutely. And on that, I just want to put out a couple more resources because that listening piece is so important. And while the name of these two things doesn't say listen, one of them actually says talk. But the partnership has a Stronger Than You Think series of helping adults understand how important their role of talking to and listening to young people is. And then SAMHSA has Talk They Hear You, which is true. They do listen to us, but actually a lot of that campaign is teaching or helping adults understand how to listen. So even though it's called Talk They Hear You, it's really about how to open up conversations so that you can listen to our young people. Because oftentimes it's so much about us, right? And then they need to be heard. Another thing I want to point out is that the partnership has a Prevention Month playlist on the YouTube channel. And one of them, it is a video of young people saying, we asked them, what do you want adults to know? How can we support you? And they answered, not scripted, they answered, we need them to listen. We need them to create space to talk to us and listen to us because we have so to say, right? And we need that connection. So on that point that Jenny just said, there's so much around that we're hearing in the state. They're actually, saying to us. So thank you for that.
Yeah. I would just also want to leave people with resources. So
Yes.
the other thing is just like, if you're listening on Facebook and you are a parent or a kid or whatever, and you came here because you're worried about substance use or mental health, just for you to, or if you work in the field, just resources for you. There is a Children's Behavioral Health Resource Center in New Hampshire. That's an excellent portal, and putting that into the chat too. And it allows you to find ways to connect to the treatment that you may need. And then also our Strong as Granite campaign is around connecting people to crisis resources, inclusive of our Doorways for Substance Use and Recovery supports, our Rapid Response Crisis Line, and 988, the National Suicide and Crisis Lifeline. And so I just want to make sure people have those resources, and then just remember to never worry alone.
Absolutely. And that 988, and those are great. And those are resources I was hoping that you would bring up and was going to if you didn't. But with the 988, this has come up in the last 2 weeks of people not, that being new information for them. It is not just for the individual who is in crisis, but it is in you as somebody supporting somebody in crisis. You can call 988.
Anyone can call, text, or chat 988 anytime. And crisis is defined by the person. And so what you think a crisis is, you can call for any reason at all.
Yeah. So thank you. Yeah. Great.
We used it recently in our house for arguing over dinner options with the kids, and I don't know how to be vegetarian while the rest of my family is not. And so we said, let's ask how we communicate about this. Let's use our resources. So I'm
Really?
giving you that random example because I want you to know that you can call, text, and chat for any kind of reason, because honestly, that's prevention. So
Yeah.
if we wait until a moment of crisis, it's much harder resolution. It's meant for for you to call in crisis, but it's also meant to keep you out of crisis. So the way that I've talked about this line with my kids is that if you need 911, if you need police, fire, or ambulance, you call 911. And if you're feeling sad, angry, or overwhelmed, you call 988. So that's how we got to, well, I need to call 988 because I'm angry. And then after you've taught your kids that, you can't say, no, this isn't really a crisis. So you've just got to lean in and say, you got to
You
lean
lean
in
in.
and say, you're right, girl, use your resources. Right. So,
Awesome.
but they were fabulous, and
Yeah.
and it was quick call because
Yeah.
we weren't in crisis, but we got to try, how do we use our resources? And I
Yeah.
think that's good for all of us because it's a connection. It allows us to just like talk through something and figure out some problem solving. And if we're doing that upstream, we now know how to use it when we really need it.
Yes. Thank you. Um, Julianne, I just want to make sure that you put in the children's behavioral health resources and the other link that Jenny shared in our private chat. Put it on over to the other one. And Jenny, I want to thank you for being here. I know how just how much is going on, and because of all the work that is happening at DHHS and all the positive work, and we're seeing it, right? And Lisa mentioned that in a comment in the chat too. She said, yes, we are seeing good numbers, and that doesn't mean we take our foot off the gas.
Mm-hmm.
Right? We keep working. Our communities are working hard, are working together with resources and support from the state, and we really appreciate that.
Yep.
So thanks for being here. And
Absolutely.
just a heads up to people, I'll be here on Monday with a grassroots effort in a local community that is looking at a response to all the news we've had around the impact of social media and screens on youth mental health. And we have had some quite a bit of partnership conversations, presentations on the impact of social media. Last year, we hosted Screenagers Under the Influence. I know that is happening quite a bit around the state right now as well. Really relevant topic for parents of young people around the impacts of devices and screen time and social media. So join us on Monday, where we'll meet to talk about a local grassroots effort to, kind of change the culture around when kids get screens and how we talk to our families about that.
On that too, Julie, like that is a topic that we could not possibly make decisions about without kids, because we just didn't have it growing up too. It wasn't the same
Totally.
issue. So huge, great example of how we have to engage youth in these conversations.
Absolutely. Yep. And it's a big effort, right? And it's not, and it's everyone, because they're everywhere, right? You can't do it in a vacuum in your own house, because it's a whole community, right? They have to be able to see their friends. They have to be able to make plans with their school soccer team, or, the art club. And if we're all expected to do that via phones at a young age, then, we gotta figure out other pathways, and we need their help. So thank you guys, everyone. Thanks for being here. And I don't know, I'll see some of you, or you'll see me on Monday.
Bye, Julie.
Bye.